All right, hi, welcome back everyone. I'm Callie, host of the newly trending Autoimmune Disorder Dish, where we give you the dish on well-known, common, and new and emerging autoimmune disorders. Today we'll be dishing on rheumatoid arthritis, a well-studied but still widely mysterious disease process. Because I'm no expert, I always try to bring on the most qualified guests to explain to listeners the pathophysiology or the causation of our disease topic. Today we're lucky to be joined by Dr. Joynt Payne, a double board certified physician in rheumatology and internal medicine. I don't want to take away her thunder, but she is going to be revealing her innovation that may very well change the face of pain management. Welcome, Dr. Payne. We are so happy to have you on today.
Thank you, Callie. I'm thrilled to be here and excited to share with listeners my understanding of the disease.
All right, so let's dive right into RA. So for listeners at home who aren't familiar with rheumatoid arthritis, it's a chronic systemic autoimmune disorder, meaning its effects are long-lasting, constant, and can eventually affect your entire body. Autoimmune disorders basically occur by the body's immune system attacking healthy cells. In rheumatoid arthritis, inflammatory response to the body attacking these healthy cells typically affect the synovial joints, articular cartilage and bone, and sometimes even extra articular sites. In short, RA can lead to substantial impairment of mobility, the loss of productivity, and disability due to pain, fatigue, and structural joint damage. So people affected by this experience periods of remission followed by acute flares of pain, inflammation, and stiffness. So triggers can sometimes be identified, but not always. Dr. Payne, do we know the exact cause of the disease?
Yeah, that's a great definition of RA. Unfortunately, the etiology or the cause of RA is still unknown, but decades of research have not left us empty-handed. Right now, the research points to a combination of factors that can potentially cause RA. First, a genetic component such as a gene for an immune protein like human leukocyte antigen or HLA, and then an environmental component like cigarette smoke or bacterial infection in the gut. So a person who has that genetic component is more likely to be triggered by something in the environment, and they may have a modification to their own antigens, and then the body's antibodies cannot recognize them and will attack to try to destroy this new quote-unquote invader. But again, there is no known definite cause. This is what the research is pointing to.
So genetics and smoking are potential risk factors for RA. Smoking seems to be a common denominator for most things we talk about on this show, so that's great.
Yeah, you got it. And secondhand smoke can be just as bad. Other modifiable risk factors include other carcinogens as well as what you put into your body. New research shows that your gut microbiome is essential for appropriate immune system activity. Yeah, so being good to your gut and feeding it with healthy foods could also help protect you from this disease process. Some non-modifiable factors, ones you can't control, are your age. The disease typically peaks in your early 60s. Being a woman, hormonal changes like menopause, having a baby, breastfeeding, and of course having that genetic component like that HLA gene. If you have a familial history of RA and any of the risk factors mentioned, I would encourage early screening. So some serum markers such as rheumatoid factor and anti-citrullinated protein antibody can be present years or even decades before any physical changes become apparent.
Wow. So I wanted to make sure myself and the listeners at home understand the physiological process of rheumatoid arthritis. So from my understanding, cytokines are released as a response to the body attacking itself, and this creates inflammation which can then damage tissues.
Yes, exactly. So the cytokines also convert synovium into a thick granulation called the pannus.
And what does the pannus do?
It almost acts like an invasive tumor, and then that chronic inflammation brings neutrophils and macrophages into the synovium, which release enzymes that further break down synovium and articular cartilage.
So then your body's thinking, I need to remember this so I can fight it off for the antibodies to become autoantibodies.
Correct. We call these rheumatoid factors.
So if the cartilage and the tissues are broken down and the synovium is blocked, does that lead to bone damage?
Yes, the bones can essentially rub together, and the inflammatory T cells produce a protein called RANK-L, which allows T cells to bond RANK, which is a protein on the surface of osteoclasts that signals bone breakdown. The process is circular because the chronic inflammation leads to the formation of new blood vessels, which allows even more inflammatory cells to come in. As the disease progresses, more and more joints can become affected bilaterally.
Wow. So from my understanding, the cytokines don't just stay in the skeletal system. They can be a multi-organ system response.
Unfortunately, yes. About 40% of people who have RA experience signs and symptoms that don't involve the joints at all. Some cytokines can go to the brain, releasing fever protein breakdown, nodules in the skin, inflammation of blood vessels, and scar tissues in lungs, affecting gas exchange and lung expansion. Yeah, the manifestations we see typically are inflammation of up to 5 or more joints in both sides, especially in the hands and the feet. Later on, as the RA progresses, we see inflammation in larger joints. During an RA flare, joints become swollen and red, painful, and over time can become stiff when being inactive for a long time, like in the morning when you wake up. If left untreated, we can see deformities in these joints like ulnar deviation and cysts in the knees. Aside from the joints, we can see fever in our patients, malaise, and weakness.
Wow. That's a lot to take in. So I actually did some research. I interviewed my aunt who suffers from rheumatoid arthritis and has for the last 30 years or so. So I thought she would be a great resource to talk to.
Absolutely.
A little bit about her. She has a family history, so aunts and uncles both had rheumatoid arthritis, and she did not smoke herself, but she did grow up in a smoking household. So with my grandfather, he smoked inside the house, inside the car, so definitely exposed. So that's important that I guess you brought up, like smoking as a risk factor. So even secondhand smoke can affect them. So she was diagnosed about 15 years ago officially with RA, but she's been living with symptoms since her early 30s after her first child. So they were able to catch her condition in time and have put her on like a special medication regimen. So she's done NSAIDs and then arthroscopic surgery to clean the cartilage in her knees. She's been on DMARDs, and now she's on biologics and says that those seem to help a lot. So far she doesn't have any like bone deformities, but she does suffer from a lot of pain. She says that the pain sometimes gets too much for her to get out of bed in the mornings, but she still tries to get out of bed because she knows physical activity is important for maintaining so that she doesn't stay so stiff. But one of the really difficult parts is that people just don't understand her condition, and that they get frustrated with her because they can't see the pain that she's going through, but she's still feeling that pain, and it's hard to deal with like just being misunderstood and having that pain to yourself. So she worries, about being addicted to pain medication, so she tries to limit the narcotics. But she's actually found that cutting out sugar and dairy from her diet have really helped decrease inflammation. So it seems like from her story, a lot of work is on the patient to help prevent RA from worsening.
Yeah, absolutely. It sounds like she's doing pretty much everything she can, right, with the research we know. While we are working tirelessly to develop a cure, we still do not know a lot about the disease. Catching it is important for the management. In a clinical setting, we look for early symptoms that can resemble other autoimmune processes like lupus and psoriatic arthritis. We'll do blood tests that look for rheumatoid factors, anti-nuclear antibody tests, and anti-citrulline protein antibodies I discussed earlier. We'll also do a physical exam looking for those classic physical symptoms. We discussed like joint swelling, stiffness. Then look at genetic markers, family history, and lifestyle. Like in your aunt's case, was she exposed to smoking? Did she smoke herself, etc.? In later stages, we can see a lot of devastating effects. Because of the increased risk of atherosclerosis, we see development of heart attack, strokes, and kidney disease. Additionally, complications of progressed RA called rheumatoid nodules. They can form and they can lead to pericardial effusions, pulmonary fibrosis, splenomegaly, necrotizing vasculitis. It's imperative to get control over RA so that these other disease processes don't occur.
That's so devastating. I didn't realize how systemic it really was, and that it can reach things that could potentially kill you. So,
absolutely. Wow.
My aunt said that she's in several support groups. Living with the disease can be debilitating, not only on your body but also your social history. I'm sure you also assess your patient's mind, body, and soul.
Absolutely.
If they aren't in a good place mentally, there's no way they'll be able to keep up with what it takes to keep their body as healthy as they can. I wanted to know what my aunt wished she existed for her condition. Obviously, she said she wanted a cure, but she knows that's not really it's something that's here at the moment. In the meantime, she says something that would help her flares. Unfortunately, that's the most debilitating part of her condition, and that she cannot predict when they will come. And what kind of leads us to your new innovation, Dr. Payne.
Yes, I'm excited to make the official announcement here on your podcast, Callie. I've created an app for your Apple Watch and phone that detects an RA flare before it arises. Yes, so sometimes patients can have a false negative test for RA if they aren't presenting with the flare. So I use this idea to see the rheumatoid factors and NAs released right before a flare, which can be seen through a sort of ultrasound technology on this app. You basically just wear your Apple Watch and it can detect it. You can also scan normal places, you can scan normal places you have a flare, and the app will alert what level you are at in the process. You can then preemptively take your medication, go to your doctor, get your shot, or do holistic things like eating anti-inflammatory foods, like your aunt does, to help prevent or lessen the effects of a flare. Flares can last for weeks, so if found early enough, I think this product can really improve the quality of life of RA patients. This may even be a technology that can help detect RA in undiagnosed individuals. I'm very hopeful.
Wow, what a privilege it has been to have you on our podcast, Dr. Payne. Thank you so much. Hopefully our viewers at home can use this information to educate and hopefully promote your new incredible innovation. First, before we continue on to our next segment, I have a message from our sponsors at HelloFresh. HelloFresh is offering a new anti-inflammatory menu. This is packed with gut-healthy and joint-relieving foods. Monday, you can try turmeric, chickpea, and kale Buddha bowl. Wednesday, have spaghetti squash with garlic sauce. And on Friday, a lemon ginger on one-pan salmon. HelloFresh offers this line with pescatarian, vegetarian, and plant-based options. Meals come with portioned ingredients for an easy but decadent night in. HelloFresh, make every day delicious.
Wow, that sounds right on the money for what we were discussing. It sounds like they're making it easier for people, right? Just get it to go. Don't even have to think about your meal. Very nice. So thank you so much for having me. I'd like to leave with just a final note, kind of going back to what you said your aunt does and with support groups. Having an incurable disease like rheumatoid arthritis can feel very lonely, but there are many support systems. I encourage anyone suffering out there to look within their community or even social media to connect with others. I hope to see a cure in the not so distant future.
Thank you for joining us. And thank you, listeners, for joining us at home. We'll see you next time.